Hello, and welcome to Certified Foundational Perioperative Nurse Certification Essentials. My name is Kimberly Jones, and I am going to be your facilitator for this overview. And just a little background, the CFPN is fairly new perioperative nursing related credential that originated in mid-2021. The CFPN is an acronym which stands for Certified Foundational Perioperative Nurse. And essentially, this certification establishes a standard of baseline perioperative nursing competency. And it's designed to be a first step in the professional development journey of those new perioperative nurses. Although a specific title or position is not required as part of the eligibility criteria for the CFPN credential, it is targeted to the early stage of the perioperative career path. So let's meet the CCI education team. We have Dawn Whiteside at the top. She is our Director of Education and Professional Development. I would be next in the line, and I'm the Manager of Education and Professional Development. I also am the LMS Coordinator. And then we have Samantha Hendrickson. She is our Professional Development Associate, and she does all of the magic to make things work that Dawn and I and Samantha come up with as a team. So we have a disclaimer, and basically, as a certification organization, CCI has a role in developing and administering certification examinations. We don't, as a company organization, require or endorse any specific study guides, review products, or training courses. You may choose to prepare for the certification exam in any method that you choose with any materials that you choose. Purchase of CCI materials isn't a requirement for testing, and it doesn't necessarily imply successful performance of the certification exams. There's no study resources that are prerequisites for the certification exams offered by CCI. So here are the objectives for this webinar. We're going to appreciate the value of certification. We're going to look at the development of the CFPN credential. What are the eligibility requirements to sit for the certification exam? And then let's look at the subject areas for the CFPN certification exam. What resources are available to prepare? And then key processes associated with earning the CFPN credential. So here's our first objective: to appreciate the value of certification. And it's best to begin with a definition of what certification is. And as defined by the American Board of Specialty Nursing Certification, ABSNC, certification is the formal recognition of the specialized knowledge, skills, and experience demonstrated by the achievement of standards identified by the nursing specialty to promote optimal health outcomes. So it's important to note that the CFPN is accredited by ABSNC, and therefore it's eligible for consideration on the Magnet scorecard or the Magnet demographic data collection tool. So there are advantages related to certification. For example, certification is a great tool to demonstrate one's commitment to proficiency and practice to the public. It's a measure of personal accountability to validate competence within the specialty of perioperative nursing. And the achievement of certification is an important part of professional or personal satisfaction. So with the CFPN, one can take charge of their career and earn a credential early in their career. Obviously, there's just a few, and I'm sure many of you can think of several other advantages. So there are benefits to patients, nurses, and employers. Documentation of competency. So for the facility and employers, their benefit includes documentation of that competency via a well-documented test, a psychometrically sound test of the nurse's perioperative specific knowledge. The CFPN also fits well within the PTAP and ANCC magnet frameworks. It's an avenue to increase your certification rates, as we've already mentioned. And it serves as a step in professional development planning for the residents' new fellows that are part of PTAP, which is Practice Transition Accreditation Program from ANCC, the American Nurses Credentialing Center. So why a CFPN? Well, many nurses who enter perioperative nursing do so at the entry level. They have minimal or even no prior exposure or experience. And with that said, there is no standardized path to become a perioperative nurse, and therefore it's largely an employer-driven process. In addition, there's a gap between the end of perioperative nursing orientation and when one is eligible for the CNOR or CNAMB exam, which means that after you're hired, you wait 2 years, work 2,400 hours before you can sit for those exams. And lastly, there's an ongoing need for continuing professional development. So how do we address these issues? Well, CFPN is one strategy. With the CFPN being a professional development opportunity, nurses who have recently completed perioperative nursing orientation program, right? So a facility-based, homegrown program, something like Periop 101 or another perioperative training course. So CFPN can be considered a bridge for continuing professional development. There are core features of CFPN. CFPN is for nurses who have recently completed the perioperative orientation program, as I mentioned. CCI cannot endorse a particular program. All we say is proof is needed that the candidate complete a perioperative orientation program and that they have a certificate of completion. And that program must have both a classroom or didactic and a clinical or precepted component. The CFPN, once you earn it, it is good for 2 years and then it expires. There's no recert, there is no renewal. CFPN leads you on to other perioperative related credentials like the CNOR or CNAMB. So in the language of credentialing, it's a stackable credential and it leads one to the other of our credentials. Another important thing about CFPN is that early on in a nurse's career, it connects one to all of the resources at CCI, our learning management system, and all the other continuous professional development offerings that CCI has. Again, CFPN is a time-limited bridge certification. There's no renewal as it's designed to build to the next certification for the CNOR, the CNAMB. A benefit of CFPN holders is that the nurse holds CFPN will be eligible for the CNOR or CNAMB at 2,400 hours of practice and 18 months of experience, barring that they meet all other eligibility criteria for those exams. The clock starts on day 1 of their orientation. And again, CFPN nurses with a digital badge have documentation of their knowledge, skills, and aptitude. So now let's review our second objective, to review the development of the CFPN credential. So volunteer committees. CCI periodically conducts test development activities to capture the current knowledge and skill set required of perioperative nurses upon completion of their orientation. And a complete list of test development committees is presented in the task and knowledge statements for the CFPN. And task and knowledge statements are developed using the results of the CNOR job analysis and constitute a blueprint for the CFPN exam, which must be completed to earn that credential. So it's recognized that the task and knowledge statements may not reflect all specific tasks performed in an individual functioning in this role, especially if they're in a niche or highly specialized environment. But with that said, the CFPN exam is developed in accordance with psychometric best practices and principles in the certification industry. So the exam is psychometrically sound, subject to third-party oversight, and written in the same style as the CNOR and CNAMB. Exam content reflects the knowledge required of a perioperative nurse, and the input and guidance of SMEs or subject matter experts provides evidence to support the inference that candidates who pass the exam are qualified to practice in their job role. Being on a committee as a volunteer also allows for someone to gain points towards recertification. And that is beneficial when you're working on when you have your CNOR, your CNAMB. CFPN, of course, does not have a recertification period. So currently, the CFPN exam is taken online via a remote, secure, and proctored exam experience provided by our testing vendor, which is currently PSI. However, always check our website for the most up-to-date information about testing options. The CFPN certification requires that the nurse has a thorough and sound foundation of knowledge and skills required for a competent perioperative clinical practice, and that knowledge can be gained through work experience, independent learning, and formal educational programs. The CFPN exam is based on what a registered nurse is expected to know upon completing their orientation period. And the exam assesses a combination of experience and cognitive knowledge of competent clinical practice. So an understanding of the test-taking process applicable to the exam. Applicants need to successfully demonstrate competency by responding to multiple choice questions. There's a detailed tutorial on answering multiple choice questions provided at the beginning of the knowledge test. The CFPN nurses may purchase a digital badge for an additional fee, and that fee can be found on our website. A picture of the badge is here on this slide. And the digital badge is an active link to a repository, so you can share this when you do interviews, share it with your supervisor, share it on social media. It tells all areas of the test, does not reveal your score. So digital badging has the potential to provide more than pride in certification. So as I said, you can demonstrate your achievements in acquiring new skills. It promotes and amplifies your own personal brand and resume by showcasing your resumes on social media. It develops your career by achieving mastery in the skills most needed in a dynamic economy. So now let's move on to our third objective, to describe the eligibility requirements for the CFPN certification. So to earn the CFPN credential, applicants must meet all eligibility requirements at the time of application and at the time of application and pass the certification exam. So you need to hold a current unrestricted RN license in the state or country of practice, the certificate of completion from a perioperative nursing orientation program that has the didactic and clinical component needs to be submitted. If you are audited, then you are required to submit the course outline or syllabus as part of the application process. Application must be submitted within 23 months after initial hire date in the operating room. CFPN must be earned before reaching 24 months or 2 years of experience. And then currently working full-time or part-time in perioperative nursing. And that can be in nursing education, administration, research, or clinical practice. Okay, so here's our fourth objective. Examine the subject areas of the CFPN certification exam. So these are the subject areas. They can be found on our website. They're also in our study plan. And the exam is comprised of subject areas. And as you notice, there's percentages. So this is going to tell you which is the highest and lowest percentage of questions on the exam. So if we look at this, we're going to see intraoperative care right? And that's 34%. So we're looking at patient care and safety and management of personnel, services, and materials. So combined, that's 34%. Then we look at the next highest, which is infection prevention and control. And then pre and post-operative patient assessment and diagnosis. So we've already hit over 60% of the exam in 3 subject areas. Now, just because the others have lower percentages does not mean that they are not as important and shouldn't be addressed, shouldn't be studied. So tasks and knowledge statements. Each subject area is broken down into more specific items, those task and knowledge statements that are on the exam. So tasks, it's what you should be able to do. And knowledge statements are what you should know to provide that competent care for our perioperative patient. So here's an example of subject area 2, which is talking about the plan of care and expected outcome identification. So the task, what should we be able to do? Right? Ensure the care plan addresses specific patient considerations, age, diversity, all of the things. And then the knowledge statements. What do we need to know to be able to carry out that task? Right? Well, we have to know physiological responses. We have to know disease process. We have to understand patient rights and responsibilities, legal and ethical responsibilities, critical thinking. So you can read through and see what these are, and it really helps focus your study. So what the CFPN exam is it's a validation of knowledge related to current best practice. It's a reflection of ideal practices like staffing and time and resources. And you need to remember, when we take an exam, sometimes people think, well, that's not what we do. That's not what we have. Well, the exam is based on what's the ideal situation. We have enough staff. We have enough time. We have enough resources. We have everything we need. And it's developed for a novice perioperative nurse that's post-orientation. And what the CFPN exam is it's not based on individual practice or hospital policy or lack of adequate resources. And it's not focused on a single specialty in surgery or a patient population or a skill set. It's all encompassing and can cover all of the specialties, all the patients. It could be pediatric, it could be geriatric, it could be obstetric or cardiac or an ophthalmology patient. So here's our 5th objective: to discuss resources available to prepare for the CFPN exam. And the recommended study time to prepare for the exam is 3 months. So reviewing the task and knowledge statements for each subject area, it's going to help you identify areas of individual strengths and weaknesses. What can you look at? What do you feel comfortable with? Can you say, I know professionalism like the back of my hand, I have no problem. Check it off, mark it green, review a few questions to verify that, and go to another one. And as you study then, keep in mind those percentages, right? And use a variety of preparation aids or frequent review sessions. Those have been found to increase comprehension and retention of information. So it's kind of like, do it in small bites. Don't sit and study for 8 solid hours, 5 days a week. You're going to get burnt out. You're going to have a lot of information in your head, and it's going to start getting a little confusing. So break it up. Let your mind rest in between study times. Questions on the CFPN are based on current national standards of perioperative nursing practice. They are based on professional guidelines, so the ARN guidelines, for example. They're evidence-based. They must be universally accessible information. So that being said, there is no single resource that's going to meet all of your learning needs. You could read Drain's textbook, and it's not going to cover everything that you need for the exam. So you have to have best choice is to have a lot of different resources. So when you take the exam, there's always 4 options with only 1 correct answer. There are 3 options that are distractors. They might be right, but they're not correct. There is no true false. There is no multiple choice. There are no calculations requiring a calculator. There are no pictures to identify. And then you need to pay attention to keywords such as first, best, most, next. You will not see questions that say choose all of the following except. CCI does not write questions in that format. So here's a practice question, right? A sample. Which of the following statements is true regarding surgical site infections, SSIs? So option A, only 10% are preventable. SSIs are now a key quality improvement metric for option B. Option C is non-modifiable patient factors contributing to SSIs include obesity. And option D is SSIs are no longer a major issue with modern surgery. So let's see what we think. Did you get it right? Option B is correct. And as you go through like the practice exams, you will get the question with the options, and then you will be provided with the correct answer at some point with the rationale and the reference. Anytime you use a resource material, practice exams, anything like that, make sure that it comes from the most current reference so that you aren't learning something that maybe has changed. 2023 is the most current edition of this textbook, which is Alexander's Care of the Patient in Surgery. And so the rationale is, we'll explain why option B is correct. So there's some additional sample questions on the CCI website. And just take note that they're a great way to practice and prepare for the exam. But sample questions will not appear on the actual exam. So practice questions, pocket prep questions, anything that you find out there are not going to be on the exam. These are textbooks that are highly recommended. We use these for references. For the most part, there are other references that are used, but these textbooks are highly recommended for practice in perioperative nursing. You have the guidelines. That's our standards pretty much, right? And so we always look to the most current edition. They're always changing, evolving, and keeping up with the evidence. Berry and Cones, Alexander's, and Drains. Drains is more post-operative, critical care approach, but it has some great explanations and things that you won't find maybe in Alexander's or in Berry and Cones. So that's why these are all really good resources and they're highly recommended. Other resources that we recommend, maybe a pathophysiology book or a medical dictionary or lab tests. We do not give you the normal ranges for lab tests, unlike the current NCLEX versions. So it's not going to be the normal based on what your facility is, right? So kind of have an idea of what is considered the general normal lab diagnostic test references, right? Anatomy coloring books are great to figure out what organ are they talking about? What's around it? What do I need to think about? The AORN Journal has a lot of good articles. They have CE content. The AMI standards, the AAMI standards, those you will find typically in your sterile processing department. So go down there, ask them, hey, do you guys have these standards? Can I look at these? I'm trying to study. And they should be fairly willing to let you borrow to do that. And then a drug reference. Check your hospital formulary Or Hippocrates.com is a great resource that you can download. It's an app and you can download it. And when you're interviewing your patients, you're like, I don't know what that medicine does. What do I need to think about? You can just look it up real quick. Optional resources. Look around you. You have a clinical setting. You have anesthesia at your disposal. You've got sterile processing. You have the recovery room. You've got radiology, lab, risk management. You've got surgeons. Even wound ostomy nurses, advanced practice nurses, you've got a gamut of places that you can go for resources as you study. And then other additional resources. So we have the CFPN Pocket Prep app, and then we have an on-demand prep course that you can attend. There are fees for both of those. And then prep resources. So we have a study plan. It's free. It's on the website. And it is pages, but it goes through each subject area. So the areas that you saw with the percentages, it's broken down, right? So post-op pain assessment and diagnosis, it's 15%. And it gives you the topic and then keywords. And then you're going to be finding additional references or resources to look at and read to understand more about those if you have questions. And then we always highly recommend that you download, save a copy of the candidate handbook and use that as a resource. Okay, it's going to answer your questions about research, certification, research, of any of our credentials. It's going to give you all sorts of information. Additional resources are going to be, of course, the CCI website, AORN with their OR nurse link, their specialty assemblies. You may be a member of AORN as a new nurse, and you may not. The Joint Commission is a great resource. They make a lot of regulations that affect what we do in healthcare. The World Health Organization, CDC, AHRQ, the Council on Surgical and Perioperative Safety, and then we have MHAUS, MHAUS. And it's the Malignant Hyperthermia Association, and they are the gurus for malignant hyperthermia. Anytime there's a MH crisis, you can call them and they can talk you through everything. They keep all of the data in the U.S. on patients that have malignant hyperthermia. And the AORN guidelines refer nurses to this as a primary resource. So that's your go-to for them. So our sixth and final objective, review key processes associated with earning the CFPN. So this is a picture of our current website. When you click on and go to the Certify and the CFPN, this is what you will see. And you can apply for the CFPN by either creating an account, or if you already have an account, log into it, right? And if you already have an account and you aren't able to access it, please, please, please do not create another account. Simply reach out to CCI to obtain assistance with accessing your current account. Sometimes it happens on the weekend and you're like, I need to get in there now. Just a little breath, and we'll help you out. And then you'll click the apply for certification button, right? And the application takes about 15 minutes or so. And the following information is what you're going to need to have to complete that application. You're going to need your personal contact information, address, home, work phone number, and email. Make sure that you're using an email that you plan to use long-term, and that email is going to allow you to receive communication from CCI. Your email is also your login ID. So when we say long-term, if you use your employers and 3 years down the road, you say you have to transfer, live somewhere else, or something happens and you don't work there anymore, then you're still using that as your login. So it's really good to just use one that's going to be your long-term email. You need to use your legal name as it appears on your original valid, unexpired government issued ID that has a signature on it. You'll need your nursing license information with the date, number, and state or states that you're licensed to practice. Your perioperative work history and the date you began working in the OR, your current position, current practice area, your employer contact information, such as facility name, address, phone number. Who's your supervisor? Provide all of their information. Your perioperative orientation course and dated certificate of completion, and then the course syllabus. And just have that on hand so that if there is a reason to be audited, and sometimes they're just a random audit. You may have everything in a row, but they just do an audit and they want to check, right? So have a copy of that, save it in a file, email it to your personal email. That's the best thing, because if you save it on your computer and your computer crashes, it's gone, right? You can't retrieve that. But if it's sent to your Gmail or your Hotmail or whatever email account you use, you can access it at any time. And then you'll be expected to pay. So this kind of shows what the application process is. During your month that you want to, before you can sit for the exam, you do all the application process. The application gets approved and you get a thing that says, okay, you're good to go test. You'll then have a 3-month window to where you can take the exam. And this slide shows it a little bit better. So to schedule, you're going to go to the PSI exam scheduling button in your account, and you're getting directed to their scheduling system. So again, your 3-month testing window opens the month immediately following the application submission. If you submit your application in, say, February, then your testing window is March, April, and May, right? And this is a great just visual to think about, okay, if I submit my application here, when can I take my exam? It really helps people with scheduling and thinking about, oh, I was going to take a break and go on vacation, or my kids are in spring break during this time and it's their summer. I don't want to take a test then. Life happens, right? It's the applicant's responsibility to schedule an appointment and ensure their appointment is completed before the end of their testing window. So think about those what ifs when you go to schedule your exam. And you may only test once during any testing window. Exam fees. Applications cannot be processed without payment. All fees or any outstanding debts to CCI that you have or may have must be paid in full. All required fees are non-refundable. So remember that the CFPN is essentially a fast track to the CNOR and or CNA&B with the lessened eligibility requirements. And having the CFPN is not a requirement to apply for the CNOR or CNA&B. There are volume discounts for healthcare systems wanting to certify multiple nurses, and that information can be downloaded from the CCI website. And then always verify the fee, current fee structure on the CCI website, as they are subject to change. So exam results. Again, the CFPN exam is remote, secure proctored test. It's offered to applicants 24 hours a day, year-round, as permitted by PSI. Sorry about that. Appointment availability. So the exam is only available on your personal computer through PSI's remote secure proctored exam. It's 120 multiple choice question, and of those 120 questions, 100 are used to calculate your test score. The remaining 20 questions are pre-test questions, and they don't affect your score. Pretest questions are scattered throughout the exam. Can't identify which ones are, say, a pretest or a sample question to see if it's going to work. You can't identify those. Again, the exam is a time test. It has to be completed in 2 hours and 30 minutes. The computer hosting the exam will keep the official time, and the computerized format of the test requires basic computer knowledge. So there's an optional pre-exam tutorial that provides instructions on how to take the test, how to select answers, how to mark questions you want to return to and review before you finish. The time allotted for completing the tutorial is completely separate from the exam time. There's one reported pass-fail decision score. The score is determined, by converting the number of questions answered correctly to a scaled score ranging from 200 to 800. And you need a total scaled score of at least 620 points to pass. You should answer all the questions on the exam because questions that you don't answer, they may count against your final score. So the scaled score isn't a number of questions you answer correctly, nor a percentage of questions you answer correctly. It's it allows for consistent scoring across multiple exam forms. So you will be shown a pass or fail notification immediately after you complete the exam. CFPN is only a single take option. If you're not successful, then the candidate has to reapply with a new application, submit a new exam fee. If the candidate fails, then you receive a score report that breaks down the knowledge areas of the exam and how you performed in each area. And what that will then do is tell you, hey, I need to study this more. I thought I knew this better, but obviously I need to go in and put some more time into this, figure out what I missed. So before we conclude, let's talk about an extension year. And an extension year extends the time of your credential by 1 year. So it allows you 1 more year to either meet eligibility requirements, say current employment, or prepare yourself to obtain either the CNA-MB or CNOR credential. Your CFPN credential will remain active during that extension year. And you need to contact the credentialing team, and the best choice is by the email at the bottom here, info@cc-institute.org. The extension year is only available once for each person that holds the CFPN credential, and there is a fee associated. Again, verify the fee structure on the website. You have to apply for your extension year prior to the expiration of your credential. And that again adds 1 calendar year to your original expiration date. No additional time will be granted for your extension year. So you can't get an extension year and then pay and get another one and another one. And there are no refunds or discounts that are applicable for this. So any questions? Contact us at info@cc-institute.org. And thank you for participating in this review of certification for the CFPN credential.